So today we're going to discuss the importance of health literacy in the workplace and why it is crucial to empower employees to understand their benefits and become better healthcare consumers. Now, when we're thinking about benefits, clearly employers are very invested in their time, their energy, their resources, which shows employees that they care about their overall health, care about their future. But in thinking about benefits, they're very closely related to great organizational culture. And when implemented correctly, employee benefits and benefit solutions serve as one of the most effective tools in not only creating, but maintaining that great culture that we've been talking about for 2 years. So I'm joined today by our friends at WA Group. WA Group is a 100% employee-owned ESOP dedicated to helping employers manage one of their top profit and loss items, healthcare. Informed, empowered employees are the key to creating a healthier, more cost-effective workplace and one of the main ingredients in reducing anxiety, financial stress, and increasing productivity. So I'm joined today by Ron Linneman. Ron is employee benefits consultant and risk advisor. Ron has over 20 years of experience in strategic health plan design. He began his career at Automatic Data Processing, helping employers with their payroll and human capital management needs. Following his career at ADP, Ron and his business partner started an employee benefits consulting firm where they helped hundreds of employers create a better strategy to attract and retain top talent. After 5 years of growing his own business, he merged with Western Insurance Agency, now rebranded as WA Group. In the last 15 years of working at WA Group, Ron has continued his focus on helping employers attract and retain top talent and has now become an expert in healthcare financing. Ron specializes in designing health plans to coordinate with employer business objectives, employee needs, and delivers bottom line impact on healthcare investments. We are also joined by Nancy Biber, employee benefits education coach at WA Group. Nancy has spent over 30 years in the health and wellness industry. She began her career as a certified personal trainer, working in fitness centers and an eating disorder treatment center, ultimately opening her own personal training business. In 2010, she transitioned into corporate wellness and served as the health and benefits manager at an employee benefits consulting firm in the Twin Cities. When the president of the firm went on to open a new venture focused on employee communication, education, and engagement of healthcare consumerism and employee benefits, Nancy was asked to join as a customer success director. In 2021, she took this concept to WA Group and started VAST University, an education and advocacy program. The goal is to control claims cost and, more importantly, help employees gain better understanding of their healthcare outcomes by understanding their benefits and being knowledgeable consumers. So thank you, Ron and Nancy. I'm going to turn this over to you at this time to kick us off.
Thanks, Amanda.
I'm kicking. Thanks, Amanda. It's our pleasure to be here with this and speak with this great culture series. I'm going to start by telling you a story. Now, here's my warning. It's getting close to lunchtime, so if you're just about to dig into that sandwich, there's sensitive subject matter coming your way, so you might want to hold off for a minute. So this is a story about a healthcare journey that someone very close took, somebody very close to me took, and I want to share it with you. So it was summer or fall 2016, and we'll call him Ron. We'll call him Ron. Ron was having the following symptoms that were becoming worse and worse. The symptoms, all right, here's your warning. Blood in the stool, bloating and gas, abdominal discomfort, things like that. So a few months go by and he goes into the clinic and he meets with a nurse practitioner. The diagnosis, internal hemorrhoids. So over the course of the next 3 months, he would go to the clinic one day each month, have a procedure, it was termed rubber band ligation, to remove one of these internal hemorrhoids. Each time he went in, the cost was $2,000 besides the discomfort, the missing work, etc. So this is going on for a few months and symptoms are worsening. So this time that we're in February 2017, he's referred to a colorectal surgeon. Again, same diagnosis, internal hemorrhoids, and this time a surgery was suggested. So the following month, a surgery was performed called a hemorrhoidal dearterialization, a cost of about $11,000. The recoup time was about a week. So now we're entering late spring, 3 procedures, a surgery, symptoms are still worsening. He goes in for an outpatient exploration surgery. Good news, surgery went well. Bad news, what is going on? So 9 months from the start of his first complaint, a colonoscopy was performed. Now, why wasn't that colonoscopy performed 9 months earlier? Because he had had one within 3 years and it was clean, and I'm doing air quotes to clean. Probably never was clean, probably was probably something growing wasn't detected. But anyway, when he went in for this colonoscopy, not only cancer was found, but it was stage 3 colon cancer, unfortunately. So immediately he goes in, 6 weeks chemo, 6 weeks radiation with the typical symptoms of neuropathy and nausea and fatigue. Just to name a few, many days off from work for treatment, recovering from side effects of treatment. And then about 2 months later, an 8-hour surgery to remove the cancer was done. He remained in the hospital for about a week, out of work for about a month, hooked up to an ileostomy bag, and then underwent 6 months more of chemo. Price tag was about $250,000 for the surgery, and sat with that ileostomy bag for about 6 months when a final surgery was performed. Another week in the hospital, another recuperation, convalescing at home for about a month. The final cost of the 1.5 years of tragedy and stress was about $500,000. The reason that we start that way, besides making you feel uncomfortable and queasy, right now, is because these are the types of situations that are happening to your employees. And as their employer, you are in a unique spot to help educate, to help support. In what did I say his name was, Ron?
Yeah.
In Ron's case, a second opinion could have avoided so much tragedy and expense. And this is the reason for our talk today.
Yeah, so just imagine if Ron, in this case, was educated, knew about second opinions, knew about the percentage of first opinions that are inaccurate, knew the process on how to go about getting a second opinion. Education and health literacy is extremely important, not only for the detection or the right detection of specific health claims, but just the overall feeling of helping your people understand that there might be a better way of going about doing this. And so there's really 3 areas we're going to be touching on in this presentation. It's just understanding what the problems are. Nancy had discussed one of the major problems when it comes to not understanding what your benefits are or knowing how to use them. Walking through why health literacy is an extremely important part to helping your people navigate the healthcare system, getting them the right care at the right place at the right price, which then leads back into controlling that pesky P&L expense over a longer period of time. And then walking you through solutions on what high-performing employers are doing to help address that issue. So what are some of the issues that we're dealing with? Obviously, skyrocketing healthcare costs. This is at no surprise to anyone that's on this call, but what is leading to that? The healthcare industry, the cost of care is increasing. Specialty pharmaceuticals are going up 14.5% here in 2024. The cost of care is getting to a point where we as an organization need to help our people identify providers in the industry that are going to provide the care that they need for the best price. Medical overspending, as soon as I hit that out of pocket, everything is free. Poor utilization of benefits is a critical part to why the expenses are increasing. And just the stigma going to HR. Right now, the common response I get from employers is no news is good news. And right now, your people, the spouses, the children, there's a number of individuals within your organization that are going through a significant health experience right now. And employers have the ability to help them through this mess we call a healthcare system.
Click, click, click. There we go.
So I think it's important to understand that even though you might think employees understand their benefits, statistically, we can tell you that many of them not only don't know the benefits that are being offered, but they're uncertain of what benefits are being offered as at your company. It's also important to understand that employees really do want additional information on their benefits. This was a study done by a BEAT study back in 2022. And currently, as most of you on this webinar probably know, the majority of education is being done during a 1-hour open enrollment meeting. The spouse is typically not present. 9 times out of 10, the spouse is also making decisions on the health plan and program for their family. And so understanding that employees do want more information and showing you how you can go about as an employer providing more information to them throughout the course of the year.
Okay, so we're going to go ahead and launch the first poll. This one actually makes me giggle, but it proves the point. Who do you turn to when you have a benefits related question? Is it HR? Is it the CFO or the accounting department, senior leadership or ownership, a manager, or your wellness coordinator? So we'll give this a couple seconds to collect the answers. In my former position, I worked for a construction company, and it shocked me the number of people, the number of individuals who asked me benefits related questions. And real quick, I realized I needed to become knowledgeable about this because I didn't know a lot of the answers. So we'll go ahead, and I see some wellness coordinator answers are coming in. Yeah. Okay. I'm going to go ahead and close this poll and launch the results and show the results. So mostly HR, manager, and a little bit for wellness coordinator as well. Ron and Nancy, does this surprise you at all?
We just feel bad for HR when we hear that, because you know, that's they're not necessarily, they might be well versed in benefits, but they're probably not well versed in the healthcare system.
Mm-hmm.
And in the end, there's very little tools. Now it's getting better, but very little tools that help support HR when it comes to specifically navigating healthcare, right? You know, unlike Amazon, you log in, you can search all of the products within that industry. It gives you reviews, it gives you costs associated with that. That's not the case, you know, when researching doctors and understanding what they're going to charge for certain procedures. So it's very difficult for HR to be that support for the people.
I actually have 3 situations on my to-do list today to do that for 3 different employees. It's not easy.
It's not, and absolutely HR is so overburdened at this point. So this is going to lead us to our next question, which Ron and Nancy highlighted in those previous slides and in the charts. How frequently does your organization communicate around benefits? Is it just at open enrollment with your 6 stack, or is it more frequently? So we'll give this about another 30 seconds or so to collect the answers. Okay, and let's go ahead and close it and launch, show these results. So most still at open enrollment with your thick paperwork stack that gets thrown in a drawer. And then we're at twice a year, quarterly, monthly, or bi-weekly. Any feedback on this, guys?
The average employer, through their benefits package, when you think about the benefits that they offer, includes your normal medical, dental, vision, life, disability programs, right? You might have some EAP, wellness programs in there, but within those programs, specifically just medical, you might have telemedicine built into that. You might have some sort of wellness built into it, and EAP could be built in that, into your life. You got grief counseling, you got will preparation, you got benefits built into benefits. And so when you just think about the 5 common benefits, those 5 common benefits, there's probably 35 benefits built into those 5.
It's like my greatest joy. I say, we're going into Target and I'm going to show you everything that is free for you in Target. And you didn't even know all this was free. So even if you never touch your health insurance, which maybe hopefully we don't because we're just healthy, you still have so many unused benefits available to you.
And we haven't even gotten into how to use them, right? And so it's just the education on here's your health plan, here's a deductible, here's coinsurance. But when only less than 3% of people understand what coinsurance is, it makes it very difficult for you to now understand, well, how do I use this and what should I pay?
Absolutely. Okay, guys, I'm going to turn it back over to you.
You see our screen here. Let's go back here. There we go.
Oh,
okay.
I'm sorry, Ron, can we go back one? I want to mention one thing. As we're talking about communication, what tools or strategies work best at your organization? So drop these into the chat if you have a unique idea, if something really works for you at your organization. We all want to hear about it. I know I've said this before, but the back of the bathroom stall is the single best place I ever put any communication that really worked. It's a captive audience. So drop that in, and then we're going to address and cover everyone's strategies and tools that work best near the end of the session.
Yeah, and we'll talk about some ideas when it comes to different communication tools, but I would love to also hear how Employers are communicating it to the employees' families, right? Specifically their spouses. Moving on here. So there are, as we all know, a number of different problems in the healthcare industry. We have health insurance, which is its own beast. We have the healthcare system, which is another area that requires navigation and is extremely complicated and only getting worse. And then that's not even to mention all the other benefits that come into play, right? And so what are the top 4 reasons why benefits communication is a problem? I mean, typically employees only hear, right, once per year. And so think about receiving 35 pieces of information on your benefits program once per year in an hour setting. You're with your other 100 employees or your 100 colleagues. You're probably not asking the questions that you should be asking as it pertains to your own personal health, how the benefit specifically affects you, what you should be looking for, what your spouse cares about, how it impacts your family. So just having a lack of benefit information over the course of the year is one of the biggest problems.
And it's not easy stuff. Once you start talking about some of these benefits like HSAs and FSAs, and we're talking about IRS guidelines, once you say the IRS, my brain turns off.
Yeah. Well, and then you got jargon, right? HSA, FSA, HRA, we had co-insurance and co-pays and deductibles, and you got terms that even when you're reading your benefits packet, you don't understand what it means and how it impacts you.
Yeah. A recent study said less than 4% understand the 4 main health insurance terms, being deductible, co-insurance, co-pay, and out-of-pocket max.
Yeah.
So just put that in your head and think, if we asked you to define those right now, could you? I don't know, could I? No.
Well, and then add into the fact that chances are they're probably not even reading it anyway. I mean, keep in mind that the majority of the claims that come in from an employer standpoint are only made up from 15 to 20% of the people. So that leaves 80% of those individuals that are not even reading it to begin with. And let's face it, there are other things that are happening from a business standpoint that require HR and require people and require a lift. And that typically then leaves inadequate time for employers to help their people throughout the course of the year.
I think you have to click.
There you go. So in the end, employees need more help navigating benefits, all right? I think we beat that with a stick, right? And again, it's not just educating on the plan, it's educating on how to use the plan, right? How to set up appointments with healthcare providers and setting up the right appointments. Is telemedicine the right fit? Is urgent care the right fit? Following up on referrals to see other healthcare providers, including specialists. That gets back into the second opinions and why those are so important. Keep in mind, by the way, statistically, 20% of first opinions are inaccurate.
Unbelievable. I'm looking at this slide. It says set up appointments with healthcare providers. I got 2 calls just this morning about people who don't go get their flu shots because they don't know where to, they know their plan's going to cover it. They just don't know where to go, so they just don't go. Just as something as simple as that.
Yeah. And so in the end, obviously, as you can see, there is very little to no support when it comes to navigating the benefits and the healthcare system.
But employers also face difficulties.
Yeah, I mean, a lot of times you're also trying to figure out what's the return on investment when it comes to your benefits program. We know that employees want healthcare benefits. It's number one on the list every single year. I just saw a survey done 2 days ago where it was healthcare number one, working virtually number two, and setting your own hours number three. So year after year, healthcare is the number one benefit employees want from their employers. So they want it, they need it, and so now what's being done to now educate and navigate it. So using different solutions like digital vendors to help with it. How do we help our high claimants navigate the healthcare system? How do we identify them? You know, if there aren't systems out there to help navigate cost and quality, what do we do? How can we be supported? What should we do to design our benefits program to make it easier for employees to navigate the healthcare system? I don't think it's any coincidence that the health insurance carriers design the plan.
I know, seriously.
The way they do.
Seriously. Does it have to be so complicated? I don't know.
So what do employers want when it comes to educating on the benefits? Increased education of the benefits program is number one with a bullet. But moving to online enrollment can help that, right? Providing 24/7 access to all of their plan information is a great option to help move the needle. Establishing the goals, really understanding what the employees want, and then developing a plan around that. Keeping enrollment open for longer. The one-on-one benefit counselors, in my personal opinion, has absolutely been a game changer, at least during the open enrollment period. It gives that person the ability to invite a spouse. You can now do it virtually at home. And more importantly, it gives them a setting to be able to ask their own personal health questions in a secure manner that allows them to pick the plan that makes sense for them and their family.
All right, so why does all this matter? So we're going to take you through an employee's journey, a little step into the healthcare system. So ABC employer incentivizes annual preventive care visits, which I love. So John Doe wants to go to take advantage of getting his, company swag when he gets his annual preventive visit. But here we go. Where do I go? What even type of provider do I go to? How does my health plan work? Will I have a cost? How do I know that the provider's in network, but how do I know they're high quality? Okay. So we answer those questions and they go in and, oh my gosh, they're in the doctor and oh no, they say their back hurts. So all of a sudden that free preventive visit is no longer free and now it has turned into a diagnostic visit. So then once back pain is complained, then the provider, what do? They send them in for an MRI. Do they go to the inexpensive, do they send them to the inexpensive standalone clinic on the corner? No, they send them to either the healthcare system or the hospital, where prices range. You guys, I've seen thousands of dollars difference between an MRI at a standalone clinic versus an MRI at the hospital.
Well, and they're not going to refer them to a competitor.
No.
Right? So they're going to try to keep them within their own healthcare system,
Exactly.
even though it may not make sense.
Exactly. All right, so follow me here. So poor John gets his MRI and what happens, but it indicates a herniated disc. So then the provider refers him to an orthopedic surgeon. What do surgeons do? Do surgeons do chiropractics? Do surgeons do physical therapy? Do surgeons do surgery?
Yeah. Even stem cell therapy is big now, right? They're not going to do that.
They're not going to do that. So how does John know what questions to ask? How does John Doe know this is the correct diagnosis, that this is the best specialist, this is the correct treatment plan, and maybe there are less invasive procedures that they could take advantage of? But then how does John Doe know how to coordinate care between perhaps a chiropractic or a physical therapist and the primary care provider and perhaps the surgeon? And how much does all this cost? And is chiropractics, is physical therapy, is injections, is that covered under the health plan? How many times is that covered under the health plan? Do I need pre-authorization for any of this? Okay, now let's cut through all that and go, now the medical bills. The medical bills are coming in. Do they understand how to read the medical bills? Do they understand how to compare the medical bills with their explanation of benefits? Do they know what their explanation of benefits even is? These are the kinds of questions I get every day. And I'm sure some of you who are out there in our HR, you probably get these same questions. What if there's issues with the billing? Who do I call? How do I appeal? How do I pay? Do I have money in an HSA? How do I use it? Do I have money in an HRA or an FSA? Do I have a debit card? How does that work? Did I sign up for short-term disability if I'm off? Does my employer offer short-term disability? What about, did I sign up for voluntary benefits? Like, awesome if I signed up for hospital confinement, but I don't know if I did, and I don't remember because that was a year ago. So we're just really trying to paint that picture of how you can provide education so employees are familiar with all this, from understanding the preventive care to reading medical bills to knowing when to get second opinions to questions to ask to how to shop for care. This is all information that you as the employer can share with your employees before they're in that situation.
Well, and it's obviously education is a main component of it, but it's only half of it.
It's only half of it.
Right. The second half of it is now the support,
Mm-hmm.
right? Being able to take that elevator down the hotel room, go to the concierge and be like, what restaurants are around here? You know, where should I go? Can you schedule that appointment for me? Just being able to have that one point of contact to be able to help you understand what's available and support you through that journey.
All right, we're going to talk about just sort of level set here. What are we talking about when we talk about health literacy? You see the definition there on your screen in that red bullet point, and you also see why it's important. It's important because we all need to learn how to navigate this complicated system of ours, finding doctors at this time of year, perhaps deciding on which plan is going to work best for us, which voluntary benefits are going to work best for us, and everything else that you can see on that screen. I don't need to read that. This slide illustrates how a lack of literacy affects your employees. So 75% of us consider healthcare decisions as the most important and expensive decision we make, yet the process of choosing and paying for services is so daunting that what happens? We decline treatment, we delay treatment, we avoid it, and because we just don't want to enter this system. There we talk about, it's estimated that 80% of the medical bills contain errors. So if you're one of those people who just pays the bills, you're not only perhaps paying more and affecting your wallet, but you could be impacting the whole employer plan's wallet. ER. We get to see on some of our groups why people are going to the ER. and it could just make you just feel so bad, because everyone knows it is not fun going to ER. And when you're going for reasons that you could seriously be sitting on your couch calling into telemedicine, or at the very least going to urgent care, besides just how difficult it is and time consuming, you are subjecting yourself to $1,000 medical bill. And I think you already talked about second opinions. Mayo Clinic recently did a study, and that's the stats there. The second opinions cut the rate of diagnostic errors from 50 down to 20%, down to 26%. So we want people to know about second opinions, and then the medical debt. And this just like hurts my billfold. So this was a recent study by Kaiser Family Foundation, and they said a quarter of us owe $10,000 more in medical debt, even though half of those people have employer-sponsored health plans. From the survey, 46% of the respondents with medical debt selected ER visits as the biggest reason for that debt. This is what just kills me. It was found on this study that including deductibles and premiums, we spend an average of $12,520 on medical expenses every year. The average hourly wage in Minnesota is listed there at $19 an hour. So, you know, Amanda, maybe people make a lot more in Dallas and it's not such an effect, but here in Minnesota, we could be spending almost a third of our wages on health care. So let's talk about what employers can do.
I think we all understand now it's a problem. What we've been doing is not working. And so now what are the solutions?
So we talked about what the definition of health literacy is. We want to help teach it. We want to help improve it. We're going to put it on the back of bathroom doors, like Amanda said. We want to prioritize well-being and preventive care and help build positive habits for your employees.
Well, and a lot of that also has to be top down, right? It has
Absolutely.
to be the culture you're creating.
Yes.
Are you a culture of health and well-being, or are you not, right? It can't be something where, hey, we just want to educate you on your deductible and maybe an understanding of your dental plan throughout the course of the year. It's really investing in your people and understanding the importance of that.
Are you a great culture?
Are you a great culture? Exactly.
So here's our suggestion on an ideal framework to control spend, retain profits, help your employees. First of all, survey your employees. If you ask them, do you know what your deductible is? They will say yes. If you ask them what their deductible is, they will not know. So survey your employees. We're going to talk about what data together on the next slide. Set your metrics. What does success look like in your organization? Then take all that information and develop your year-round 360 degrees culturally appropriate campaign, and have a person dedicated to this mission to make sure your employees feel like somebody is walking their healthcare journey with them, and continually measure success. I wanted to talk about this story from this family, and it was funny because we heard a little bit before and then a little bit after their employer put this type of program in. So as all employees do, they sit through open enrollment, and the only thing that they remember is how much their premiums are going up, which, let's say, they mostly go up. They don't very often come down. So in this case, Craig comes home, tells his wife, Linda, premiums are going up 10%, and that's all Linda hears. That's all his wife hears. So later that month, their daughter is complaining about acne. So Linda jumps into action, takes Haley, their daughter, to the dermatologist who recommends a laser skin resurfacing procedure. They were told this procedure was quick, it was easy, little downtime, so Linda signed on the dotted line for Haley to have that procedure. She knew very little about Craig's health plan. She didn't know what questions to ask. Specifically, is this procedure covered by insurance? And all seemed wonderful until the $3,000 bill came from the dermatological office. That's when they found out the treatment wasn't covered, the office wasn't in their network. Then enter their education program. The next time they take Haley to the doctor, they go to an in-network dermatologist and they get a prescription for a gel acne medication that was $520 for a pump that lasts a month. This time they know, because of their education, about ways to save on pharmacy. So they go shopping and find this epidural, I think it was cost $38 they find after getting a little bit of training on this. So let's talk about what kinds of education we want to provide. We talked about gathering data in the ideal framework slide, and this includes the results from what we called our sort of healthcare IQ benchmark survey. But Ron mentioned earlier, all benefits come with more benefits. So your health plan comes with a wellness program. It comes with cognitive behavioral therapy apps. It comes with a marketplace, merchandise marketplace, where you can get discounts on things. We want to get information on all our benefits and all the value adds to give to your employee. We want to know what benefits we want to lift utilization. Maybe it's your telemedicine, maybe it's your wellness program, maybe it's motion connected. We want to know what your claims experience is. Are your folks going into for their preventive care, their mammograms, their colonoscopies, so that they don't end up in the same situation that Ron ended up with? So this is all the type of data we want to gather.
Yeah, not all high utilization is bad utilization.
Right, exactly. And then now we have this wealth of information. How do we get it to your employees and spouses? Best to piggyback on how you do cyber training or how you do safety training, and use the engagement ideas that Sarah in the last month's Motion Connected Great Culture series shared with us. And then everything listed here on this slide. Should we take a look at the chat?
Sure. Thank you for that, guys. That was wonderful just to listen to. So we have some feedback. What communication tools or strategies work best at your organization? Feel free to drop in more that work for you. We have weekly electronic employee newsletter. That is a great communication tool. We have also seen postcards being sent home so that the spouses can see that as well. What's nice about Motion Connected and for our clients is that spouses are included with each employee. So in our Motion Connected app, as soon as you open it, you get you go right to the message board, see the benefits education content. We really touch a lot on health literacy and building that health literacy, and spouses can then see that as well as any other pertinent messages or timely messages. What we've also seen one of our clients do is incentivize the preventive care, the telehealth use, EAP use into their wellness programs as they do for annual physicals, flu shots, and any other preventive screens. So by reinforcing those really key components in being well and being an educated consumer, they have also seen really wonderful results at this organization.
Love that.
Any other, Nancy and Ron, any other communication tools or strategies you'd like to touch on? before we move on?
One that I love from one of our employer groups is they have coffee with a virtual, I should say, virtual coffee with HR. And that's where we can talk about and do a deeper dive each month into one of the benefits. It might not even be health insurance, it might be life insurance. And with the life insurance that every employee gets, whether they're on the health plan or not, they get grief counseling, they get estate planning, they get will preparation, and things like that employees don't know about.
Absolutely. And any barriers that can be broken down, whether it is virtual or bringing the vendors on site, it makes such a big difference. It really does. So as we start to wrap up, I just want to mention that everyone's going to receive a copy of the session as well as the slides. And we have a handout with 10 ways to reduce your prescription drug costs from Ron and Nancy. It's wonderful. So many helpful tips. And this Nancy's calendar here it's key.
These are just some ideas of topics that have been popular. And I know we are at the end of our time. I wish we had all afternoon to be chatting about this really, really important subject. But I want to leave you with one last story. And this was just a phone call that I received a few days ago. An employee had called and he needed help finding a provider. And this was an English as a second language employee. So think how difficult it is for us. Now think of putting us in not our original country. So this employee had a bad cold that settled in their chest, and it was making it difficult for him to breathe, but he wasn't going in for care because he didn't want to have the expense that he was afraid would come with it. This employee had free access to telemedicine. This employee had money that his employer put in their HSA for them that he was unaware of. So he could go to telemedicine for free. He could go into the provider to be seen if need be and still have that cost covered with his money in his HSA, but yet he wasn't aware of any of that. So by the time he called me, he was at a real difficult place with this, what started as a little bit of a cough.
Yeah.
So that is why we are so passionate about this topic. We hope you are too. All your employees have 4 basic needs when it comes to care. Get them their benefits, get them a doctor, get them through the complicated healthcare system, and get them better. And then we all win.
Yeah. And in the end, rely on your resources. Everyone on this call has a number of resources already at their fingertips. So utilize them and count on them. I think a lot of times, specifically the broker and the consultant are underutilized when it comes to helping you through this project.
Yep.
So with that, we just want to thank everyone for taking the time. If anyone has questions or wants to learn more, please let us know. But we certainly appreciate everyone wanting to learn more about how they can help their people navigate such a complicated system. That's a lot of clicks.
That's a lot of clicks. We'll be sending, I'm sure Amanda is sending this out for all of you.
Yes. So as we wrap up, we just want to ask you, Nancy and Ron, we ask this in all of our great culture sessions. What tips do you have for an organization to go from good to really phenomenal?
Well, for us, it's really understanding what the problem is, admitting to it that there's a problem, and investing in trying and wanting to fix it. So often we see employers have HR that wants to address it, but there isn't a top-down support really supporting that decision. And so at least for us, our high performing employers, it starts with the top. It starts with the president and the CEO wanting to have a culture of health and well-being and supporting the organization in getting there, and then relying on their resources to put them in the position that they're wanting to get.
Well said.
Very well said. Please check out Ron and Nancy on LinkedIn as well. They have excellent content that they continuously post. And just want to mention, again, any questions, feel free to send those in. Everyone will receive a copy of the recording and slides, as well as the attached handout. And look for our next session, which will be November 15th with Heidi Stein. She is the wellness coordinator at the City of La Crosse. They have an excellent program. I'm so excited to meet with her and highlight all the amazing things that City of La Crosse is doing. So thank you all for your time. To wrap up, thank you, Nancy. Thank you, Ron. This has been excellent. And we'll see you next month.